Jack, I read an article on a news website the other day saying that yous are against, you spoke out, the USI spoke out against the lobbying that the drinks industry is trying to do to influence the public health alcohol bill. Can you just tell us a bit about the USI involvement in this whole campaign for the public health alcohol bill, please?
Absolutely. So back in 2013, USI was one of the first major organisations to disaffiliate from the Drink Aware campaign.
What's the Drink Aware campaign?
The Drink Aware campaign is an industry-funded campaign around responsible alcohol consumption. So its message is very much consume, but just don't consume too much. We think that independence within public health lobbying is very important. It's very important that the interest at the heart of public health decisions is that of individuals and that of society as a collective, rather than of corporations. And I think that's all you can really achieve with players like Drinkware being active within the market. So we've withdrawn from that campaign, and at the time we weren't sure what would come next, what we would do to promote responsible alcohol consumption. I think a lot of other organisations had that fear, whereas now there's a lot more work being done by public health organisations, organisations like ours who represent people. Like ours, who represent people and try and fight for their best interests, to organise to deliver something better. Because there is, and that was one of the really unfortunate things at the time, there always was this monopoly on that kind of conversation from the Drinkware end of things. So we're looking to try and change that.
I presume this is alcohol in general is a huge issue in the USI, is it? Because there's so much, like, particularly young people drinking alcohol amongst the young generations. It's really, the problem is really huge, isn't it?
I mean, there's no evidence to specifically support the idea that young people are massive problem drinkers more so than anyone else. But I think what we do know is that Irish people have a very high consumption level, particularly in binge drinking, and that the Irish relationship with alcohol has never been good. So for the part of young people, we're trying to promote the idea that alcohol isn't necessary, for example, to have a good night. It doesn't have to be, unless you want it to be, a major part of the college experience. And we're trying, through the REACT programme, for example, to try and work with colleges to assess the level of influence that alcohol has on student life, and as best we can to configure that in the favour of student interest.
When did you first hear about the proposed and planned public health alcohol bill?
So we've known about it for a long time now, in that we work with organisations, say, like, for example, with Rory McKiernan, who's on the President's Advisory Council, with other organisations.
President of Ireland?
Yeah. Spun out, and other youth organisations that would be clued into this kind of thing. I suppose what we're trying to do now is to try and lock heads together to see to what we can do about this particular piece of legislation.
What do you think of the drinks industry lobbying Oireachtas members about this?
It comes back, I think, to the point that I originally made, is that any decision made in any national parliament, or any decision made particularly as a public health measure, should never serve the interests of any sort of corporation or any corporate interest. The public health exists to protect the public's interest. We have completely over demand in the health service, and we have people waiting on trolleys, and this is something that is directly related to alcohol related illness, and that's directly related to consumption, and that's not something that the drink industry wants to see end. The drink industry knows it has a bad name for itself, and it's trying to backtrack on that, but we're going to lobby harder.
The drinks industry, I think, are saying that they are not against the bill, they just want to see amendments to the bill. What do you think about that?
Well, of course, I mean, the drinks industry couldn't actively oppose the bill because that would come across as too negative. I think some of the amendments that are being proposed don't deal with the problem in its totality. What we really need in this country is a public health consideration that's completely free from interests that are corporate, that are profit making, and that's made by medical experts, public health experts, doctors, people who've got the interests of people and their health at mind, and that these aren't categories into which the drinks industry falls. Of course, and everyone is free to lobby a public representative. That's just a fact of it. But I would hope that public representatives would have that in mind.
So, are there any provisions in the planned act that you would be sympathetic to the drinks industry lobbying about, or do you think that the act as planned should go through in totality?
Well, I think the question of minimum alcohol unit pricing definitely needs to be explored a little bit more. There's debates, for example, over its compliance with EU law that are being resolved in Scotland. There's conflicting research as to the level of success, and I think this is something that actually could turn out to be quite a positive measure for Ireland, don't get me wrong, but it's definitely something that needs to be borne out a little bit more, first of all in terms of research, but second of all in terms of the public's perception towards it, because there's a lot of muddled facts out there.
Okay, that's great. Thanks, Jack.
No problem at all.